Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on acid reflux. Acid reflux, also known as gastroesophageal reflux disease, or GERD, is one of the most common GI problems that people face. In fact, 1 in 5 Americans experience acid reflux symptoms at least once a week. So this is a really important topic that you need to know about. We're going to be covering what acid reflux is, the symptoms, the testing, the treatment, and the complications. Now, if you enjoy content like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Now, before we get started with acid reflux, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having symptoms or if you think that you're having acid reflux, make sure to go see your doctor. Now, let's get started with acid reflux. What is acid reflux? Acid reflux is a common GI problem in which there is too much acid in the stomach, and the valve that connects the stomach and the esophagus, the gastroesophageal valve, is more open than it should be. And this results in the passage of acid from the stomach through the esophagus, and this can lead to a variety of symptoms as well as complications. What are the symptoms of acid reflux? Acid reflux can cause a variety of symptoms, in fact, an entire spectrum of symptoms. One common symptom of acid reflux is upper abdominal pain. This might be in the middle of the upper abdomen, but it may also be on the right side of the upper abdomen or the left side of the upper abdomen. Another common symptom is chest pain or chest discomfort or chest irritation. In addition, people with acid reflux can experience pain in the throat or irritation in the throat. It's common for people with acid reflux to need to clear their throat on a regular basis in order to relieve their irritation. Acid reflux can cause bad breath. It can also cause nausea or dizziness. The symptoms of acid reflux are often triggered by eating, especially if it's a large meal, or if it's a meal that contains alcohol, or caffeine, or carbonated beverages, or if you eat NSAIDs like ibuprofen or naproxen. In addition, the symptoms of acid reflux tend to be triggered by lying down. In fact, lying down is such a strong trigger of acid reflux that if you go to bed feeling fine, but you wake up with symptoms such as bad breath or chest pain or throat irritation, there's a very high chance that acid reflux is responsible for your symptoms. What are the tests which are useful in diagnosing acid reflux? Many cases of acid reflux do not require any tests. Because acid reflux is so common, if someone is experiencing the classic symptoms of acid reflux, that is often enough to make the diagnosis and to start treatment. However, there are some tests which are useful. Your doctor may decide to order labs to look for other causes of GI disease. There are many organs inside the abdomen, such as the liver, the kidneys, the gallbladder, and the pancreas. And by ordering labs to investigate these organs, it can be a great way to rule out these other organs as causing your symptoms so that we'll be more confident that it is acid reflux that is causing your symptoms. Cardiac testing is useful when diagnosing acid reflux. Because chest pain is one of the most common symptoms of acid reflux, ordering some tests to investigate the heart is important to make sure that your symptoms are not cardiac in nature and more likely caused by acid reflux. H. pylori testing is also useful. H. pylori is a type of bacteria which can cause gastritis or inflammation of the stomach. Because the symptoms of H. pylori gastritis overlap significantly with the symptoms of acid reflux, it's important to test for H. pylori, especially if you have symptoms of acid reflux that are not improving with treatment. Finally, an upper endoscopy could be useful in the diagnosis of acid reflux. An upper endoscopy is a procedure in which a gastroenterologist inserts a tube down your throat in order to visualize the esophagus and the stomach. By visualizing these structures, the doctor can visually confirm whether there are signs of acid reflux and can also take biopsies and analyze those tissue samples under a microscope to see if there's microscopic evidence of acid reflux. Upper endoscopy is most useful if the diagnosis of acid reflux is unclear or if somebody's having symptoms that are not responding to treatment. The most important treatments for acid reflux focus on lifestyle modifications and medicines. A diet that's healthy for acid reflux is one that has less alcohol, less caffeine, less carbonated beverages, less spicy foods, and is also a diet where you are not consuming NSAIDs, medicines like ibuprofen or naproxen. All of these kinds of foods and medicine, they raise the acid in the stomach and can worsen the symptoms of acid reflux. Another important lifestyle modification for acid reflux is to avoid lying down shortly after eating. A good rule of thumb is to avoid eating or drinking within 2 hours of when you're going to go to bed. So for example, if your bedtime is 10 p.m., then don't eat or drink anything starting at 8 p.m. This will help to make sure that by the time you go to sleep, that your stomach will be empty, and this will greatly decrease the risk of acid moving from your stomach up the esophagus and causing symptoms of acid reflux. The most important medicines for treating acid reflux include antacids, H2 blockers, and PPIs. Antacids include medicines like Tums, and these medicines are bases which neutralize acid. Another important medicine for treating acid reflux are the antihistamines, the H2 blockers, such as famotidine, which is Pepcid. When this medicine enters the stomach, it blocks histamine receptors in the stomach, which leads to a decrease in the production of acid in the stomach. The strongest medicines to treat acid reflux are also my favorites, and these are the proton pump inhibitors, the PPIs, and this includes medicines such as omeprazole, which is Prilosec, and pantoprazole, which is Protonix. These medicines directly inhibit the production of acid in the stomach by blocking the proton pumps, which are found in the cell membranes of the stomach cells. I highly recommend that if you're experiencing symptoms of acid reflux, that you try the proton pump inhibitors to help to get your symptoms under control. Uncontrolled acid reflux can lead to a variety of complications, and I will mention a few of those here. Acid reflux can cause asthma symptoms. When the acid reaches the throat, some of that acid can enter your trachea and cause irritation of the airways, and this can cause asthma-like symptoms, and it can also worsen pre-existing asthma symptoms. Another complication of acid reflux is dental problems. When the acid reaches the mouth, it can cause erosion of the teeth, and this can lead to gingivitis and tooth decay. One of the scariest complications of uncontrolled acid reflux is Barrett's esophagus. Barrett's esophagus is when the esophagus, after being exposed to large amounts of acid over a long period of time, can transform into a type of precancerous tissue known as Barrett's esophagus. Unfortunately, Barrett's esophagus can progress into esophageal cancer, which is a very serious type of cancer that can kill you. It's important to keep your acid reflux under control in order to prevent these symptoms and improve the quality of your life, but also to prevent these horrible complications of uncontrolled acid reflux. That's it for today. Thank you for watching. Be sure to subscribe and leave a comment down below letting me know what topics you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're having symptoms or if you think you're having acid reflux, be sure to see your doctor. Bye-bye.